Welcome to Medical Confessions. Today we're going to be talking about varicose veins. I'm Scott.
I'm Jen.
I'm April.
We are, again, we're constantly evolving as a show, and so we're trying to focus on some of our modifications for YouTube. So we're now going to be doing our podcast, but filming it. So you're not going to see April and I awkwardly turn and beauty queen smile at the camera and then try to act like we're listening to Scott. That won't happen anymore. Now we're just going to talk like we're...
And
Just
pretend
talking.
to listen to Scott.
Same thing, but now we won't be looking at the camera randomly.
Now people won't be able to see that you're ignoring me.
No, they still will.
Yeah.
Their profile will give it away. We'll start to look down and our eyes will start to close. So today we're talking about varicose veins and
We are. It's
other
exciting.
things associated. It's kind of gross. Like, I feel really horrible for people that have serious varicose veins. And I've seen them on people, men and women alike. But the reason that this is a topic that kind of piqued my interest is because my grandmother had them really bad. And I remember seeing the back of her legs and stuff and how painful it looked. And so then my sister and I have been like super like freaked out about it because neither one of us want them and it's genetic.
It can be genetic, and unfortunately, you're probably going to get them.
Well, and
percentage-wise,
I've been through 2 pregnancies and nothing. And
but you work out a lot.
I
So that
do,
helps.
and that was going to be one of my questions. So my sister's like a hardcore runner and does marathons and stuff. I don't really do that much running, but a lot of heavy weightlifting, which I would assume might also be bad for varicose veins. But
It'll
went
help.
in... Oh, it'll help.
Mm-hmm.
See, I was under the impression long-distance runners actually have more varicose veins. Like, it aggravates the situation. Well, let's start out, first of all.
Risk factors, right? It's risk factors.
Okay. So, and then I will tell you what medical steps I've taken.
Oh, you've taken some.
I've taken steps. So, we'll start out with what is a varicose vein?
Well, varicose veins, what most people think of varicose veins are actually a part of a grouping of venous diseases, so diseases of the veins, primarily in the legs, but you can actually get them anywhere. You can get them on, this spectrum of venous diseases. They're classified 1 through 6. The smallest things that people can think of varicose veins are I'm going to butcher this word, but spider telangiectasies. And those are the really tiny spider veins. You can see them on like the nose of alcoholics, or just on the cheeks of some people with high blood pressures. And those are the smallest ones. That's kind of a class 1 of this grouping of venous diseases. And those are generally less than 1 millimeter in diameter. Those are going to be inside your dermis, so they classify them as intradermal. Subdermal varicose veins, more commonly called reticular veins. Those can be as small as that 1 millimeter, but they're kind of between 1 and 3 millimeters, and those are inside the dermis. True varicose veins are greater than 3 millimeters in diameter, and you can palpate them, you can feel them. So anything smaller than that isn't technically a varicose vein, but it is in that same grouping, and people kind of just lump them all together.
Sure.
If you're talking true varicose veins, 25% of the population will get them. If you're talking about all 3 types, from the spider veins to the reticular ones, 80% of men will get them in their life, and 85% of women.
So 1 out of 5 adults, correct?
To get the true varicose veins, correct?
Yeah. But what causes this? So we're talking about this bulging, visible, contorted, painful-looking vein.
Yes.
What causes it?
Well, and so so talk a little bit about the anatomy. So the reason why they're most commonly in the legs, the venous system in your legs is kind of, 2-part. You've got your deep venous system, which is going to be like your femoral veins, and then you've got these your second set of venous system that's more superficial, and they're just called saphenous veins, and they're kind of on the outside of your muscles, and so your big veins branch off into these saphenous veins, which is where your reticular veins are, and then they go down even to smaller into these spider veins. And so that's kind of the anatomy. The reason why you see them on your legs, because they're superficial, so they're closer to the skin surface. And what's causing them is basically a weakening of your vein wall and valve problems. So whatever can cause that weakening valve wall, or excuse me, weakening vein wall and or valve problems. Your veins have one-way valves, so the blood's only going back to the heart. If those valves are leaky or they're just not working, then the blood will go backwards. And then if your vein walls are weak, that blood flow going backwards will bulge out the vein, and you'll start getting weird pathways of that. And then now you have a varicose vein. So whatever can cause a weakened wall or valve problem. So some common things are like high blood pressure. So if you have a high pressure in the system, it's going to bulge out the wall of the vein, and then the valves aren't going to be able to close as well, and so you'll get some backward flow. Inflammation then can do that. High blood pressures can do that. Any sort of compress up towards the core will cause those distal veins to then bulge out, just like sticking a tourniquet on your arm. Anything distal to that is going to sort of engorge and cause that dilation. And then anything that can cause dilation, estrogen. Women are more prone to varicose veins because they have more estrogen and progesterone.
April and I have this finger ratio that indicates we have more testosterone, so I don't know if that's really an issue.
That's true. And I had a coworker ask me, weird question, but did you get varicose veins when you were pregnant? Because they knew we were doing this episode.
Oh.
And it was prior to me studying, so I'm like, no. Gross. And then
they're doing the math for us. Like, yeah. They're like, oh, because your testosterone indicates that you wouldn't get them.
You're more of a man than a woman, according to one episode. No, but actually, pregnancy is it's a huge cause of that, because you're hitting 3 or 4 different reasons why you get varicose veins, all with just being pregnant.
Well, and what shocks me is for both of my pregnancies, like my legs and feet were painfully swollen. I didn't have like a sciatic issue or anything like that, but my legs, like from the waist down, I was disgusting. And the rest of me wasn't really huge. I didn't gain a ton of weight, but my legs, and so I would assume that, small torso, big baby, pressure into the legs, and I didn't really get them. So
it's another reason not to get pregnant.
Well, yeah, another reason I was glad I was born a man, because not getting fat and not getting varicose veins. Yay.
It's like life simplified.
Let's just break it down. But no, pregnancy, right? So you've got 30% more blood flow or more blood volume in your body when you're pregnant, so that's going to cause more pressure on the arterial
just
walls.
Seems like a monster number. That's just huge.
It is.
Yeah.
Well, you got a big baby in there.
Right, I guess, yeah.
And so you've got more blood flow, dilating your veins. You've got a big baby sitting on your vena cava going back to your heart, and so you're going to get more pressure on that up top, and it's going to cause bulging down below.
Well, and I would assume maybe it's also size dependent on the mother, because I've got tall framed friends who just had little bellies all the way up through pregnancy, and their legs, they never had swelling. And mine was like instantaneous, like second trimester sausage legs, like gross. And it's like, but I'm short. And
my nose got fat when I got pregnant. Like, everything about me blew up.
Yeah.
Even my nose got fat.
I had a friend's mom who didn't even recognize me.
You told us this story, yeah.
I didn't think she could get that fat. Wasn't pregnant, fat.
And it was a mom that knew you well, right? Yeah.
Like that awesome purple girl from Willy Wonka just blew up.
Viola.
Viola.
Is that her name?
Yeah.
Wow.
You identify with her.
I did then.
Well, yeah, so you've got those two problems, plus you've got more estrogen and progesterone circulating around your body, and estrogen and progesterone are known to dilate small veins. So you're going to get that dilation, the valves are going to have problems, and so that's why a lot of pregnant women get varicose veins.
Oh, her name was Violet.
Violet.
Wow.
That was a good guess.
You were close.
Shit, yeah.
Violet, you're turning violet.
Oh, that's right.
I do remember that.
Good.
So yeah, pregnancy, where did we leave off?
Well, we were just talking about reasons that people would get varicose veins.
Yeah, so anything that's going to cause that problems with your veins, wall, or valve problems. So age is a risk factor, family history.
Well, so that makes sense because you said 80% of men, 85% at some point will get them. So as we get older, you're pretty much guaranteed to.
Percentage-wise,
Right.
it's going to happen. If you don't, you are the exception to the rule.
And it just makes sense if you think about aging bodies and you get skin tears, or like that's just part of your body aging and failing.
1 in 5 people will get it. The average age of patients is 52, and the youngest treated so far that I have found was 13.
Oh.
Wow.
So are they truly painful, I guess is my question.
They can be, absolutely, especially if they swell up a lot. And then you can get a lot of bleeding problems with them too, because that vein wall is weaker. I saw a patient one time who I actually thought I was going to walk into see a dead body, because we walked into this house and there was that blood trail that you see in the movies, like going through this living room, and I'm like, oh my goodness.
I think I was with you.
And maybe because I think and you're like, hello.
Yeah.
And nobody's answering. You're like, oh, there's a dead body around this corner. I know it. And you follow this blood trail, and here's this nice elderly person who is just, I got a problem, and she's just bleeding out everywhere from this varicose vein.
Gnarly. Because it looked like a crime scene, like splattered on the wall, and I was like,
yeah, it was impressive.
Right. Well, and so my history with it is not wanting to have legs like my grandmother, but however, you mentioned earlier, like hypertension being a risk factor, and my grandmother had several, diabetic hypertension. She, was mildly obese. I'll say that. She liked making tamales and tortillas. But anyway, I remember her wearing like compression stockings and stuff like that to help probably with the discomfort. So my sister and I have talked about it in our younger adult age, and then right after I had my last baby, I was like right into the vein doctor and was like, prevent this. The reason I went in though was because of a visual issue. I actually hit the inside of my leg on a toe hitch, right?
Yeah.
And instantaneous massive bruise on the inside of my like knee/calf area, and it never went away. And it was like basically spider veins, and I didn't really understand the difference. To me, the spider vein was like, oh man, I have varicose veins, because the term's kind of used interchangeably. So I went to the vein doctor thinking that this is like a precursor to the big bulging ones, and wondering why this, and it is, right? And wondering why I didn't realize trauma could bring that on. Apparently it can, because it's never gone away. But when I went in, they looked at me like, oh, this is like a chick that's super freaked out about having ugly legs. And so they were like, cha-ching. So they were like, oh, let's order this test and this test. And some of it was covered by medical because, like the initial testing phase was, but then they were like.
How much did you pay out of pocket?
Like $500 to $600.
That's not horrible.
Well, and that was actually for some treatment,
a decent spa day is going to cost you that.
So what they did is they did like an ultrasound. Yes.
Does it? I don't know.
Yes. That's why I don't go to
like
the spa.
I've never been to the spa before.
They did an ultrasound, and they give you like numbers, like your scale of horrible veins.
1 through 6.
1 being the
spider veins.
Right, and so I had nothing over a 2. Like they weren't impressed at all with my claims to, and I think I might have even like elaborated on the discomfort, thinking it would be medical. If
you're
I
like
was like
every one of those people, it's a 12 out of 10.
Well, no, I
pain,
didn't
doc.
so much say that, but I don't know if I was confusing it, but now that we've done our limb episode, I understand. But I was like, yeah, like I can't squat for very long without numbness. I was like kind of feet. Anyway, they did the ultrasound and they were like, you've got some spider veins. You have a vein in each leg that is borderline starting to look like it's going to be an issue, and we can laser those. So they laser them, and it's basically non-surgical, which kind of creeps me out because, like our kidney episode, like it grosses me out when they don't take out like the gross part. So I was like, so you're just going to laser it and leave it? And they're like, oh, the body just, So they did. They lasered a vein in each leg, and they were like 2s. They weren't bad. They weren't showing. I didn't really have any major discomfort, but they kind of did it preventatively. And then they did the like superficial injection at the spider veins which is kind of cool to watch. Like they took a little needle and it like just disappears. And then I had to wear compression socks like in June
Yeah.
for like a month or 6 weeks, which was pretty horrible and uncomfortable. And I haven't gone back. And I do have more spider veins now in random spots, but I'm not a young person, you know, and I find that it's in spots where I've actually been hit or something, you know, like a weight bar or a toe hitch or something like that, and then there's spider veins. So I probably will go back and have those addressed again, and that's actually what cost me the most money, was I think the varicose veins were covered medically, but the spider veins was cosmetic, and I had to have those.
Well, it's funny, in looking at that, I looked up the American Heart Association and their journal Circulation. They did a whole thing on you know what's covered and what's not, and spider veins most of the time isn't, because it is just a cosmetic issue.
Yeah.
And if you don't like it, tough.
Well,
you know?
and when would it be? Is it when people actually have like itching and
for the spider veins?
Yeah.
No, so there is a class, and basically it's getting up into that true varicose vein, that it's larger than 3 millimeters, it's causing pain, it's causing discomfort, and there's more complications to it other than just it looks crappy.
Yeah.
So you do, I mean, the spider veins aren't really a thing to worry about. Medicare is not going to jump all over that one.
Right.
I did look up numbers, and this was, I could only, just did a quick search, so these are from 2011, but vein stripping surgery ranges from $1,500 to $3,000, plus charges from the hospital and the surgical center, and laser ranges from $600 to $3,000. Depending on how many veins needs to be treated. But I watched several videos on YouTube of watching them inject the dye. And
it's really satisfying.
It's super awesome.
Yeah, when I go do my
relief.
next ones, I'll have you go with me. Because, like, it is actually fun to watch it, you know, like, disappear. It's like instantly.
So the doctors weren't wrong when they said cha-ching, because you're coming back from work.
I just, like, plopped the checkbook down and was like, do it.
What's it going to cost? Let's do this.
Like, gnarly veins on my legs. And I'm not even like a leg shower, you know, but...
I wasn't actually interested in this topic until I started getting into it and watching the videos. And then, of course, I Googled pictures of them. And I'm sure I'm looking at, like, the most extreme cases.
Yeah.
Oh, God, I have so much sympathy. And it made me want to inspect my own legs. Like, oh, my God.
Well, you're still, like, pretty young.
Yeah, 36.
And you had your son very young.
Yeah.
So you may not have had, like, all the trauma to your body that some of us older mothers had. So you might actually come out pretty unscathed.
Yeah.
You know?
Well, you guys, I found a remedy for varicose veins.
I've heard essential oils work.
All
Some
you
types
need.
can.
Well, which is funny because I think that April and I suggested we do like an essential oil topic, like we talked about this months ago, and Scott was like, I don't think there's any studies on essential oils. Like, I think you were kind of like you and your witch voodoo girls. Like, I don't think you were doubting us. And then I read that in there and I'm like, oh, interesting.
Was that in that link I sent you yesterday? Yeah, I saw that and I'm like, oh, they're
well, then
going to
I
bring this one
Googled it
up.
more because there's a lot of claims for essential oils. And so then I was like, I don't have those ones. I'm going to have to look those up.
Yeah, so we want to talk about treatments in
let's
general?
talk about treatments.
Well, the biggest one is lifestyle changes, right? I mean, it's standing up for a long time, sitting for long times, anything that causes that, you know, pressure in the veins. So, you know, obesity is a big deal. So lose weight. Stop smoking, decrease your high blood pressure, stop sitting so much and standing so much. If you can,
don't
work.
Be alive. The rule
Stop
is
living your life.
go to the wax museum, volunteer to stand there. Well, no, standing's bad.
Well, but everything in moderation, right? Because you do need increased physical activity to build up muscle tone, and that muscle tone is going to help. You know,
well, I feel like I'm doing most of that right. What else can you do then?
Not a ton, right? So if you want to avoid wearing tight clothing up towards your core, because then your distal, you know, veins will get higher pressure. So compression socks down below, you know, avoid the tight stuff towards the core. Elevate your legs a couple of times a day if you can, and if none of that works and you actually have these things, the compression therapy is a big one. They can do the local ablative therapy, which is that where they just inject the stuff. They can do surgeries if they're super deep ones. They can just go out and strip that out. Unfortunately, that's not as effective as just like you're talking about, that they go in the intravenous, you know, cauterization, and they just use radio frequencies or lasers to get in there and laser that thing and stop that backwards flow. It's impressive, and it works.
The laser again. Like,
love the laser.
You're so jealous of the inventor of the laser.
I want a laser to do cool things.
Well, I'm going to try this one again. You guys, I found a remedy for varicose veins.
Oh, we totally like.
Oh, we ignored you.
Yeah. It's fine.
She's used to it.
I treated you like me.
I treated you like I
fine.
both treat you both all the time.
Well, apparently if you dilute apple cider vinegar and just rub it on your legs for about 2 months, apple cider vinegar, again, cure-all for everything. I'm just going to bathe in it. I'm just going to take baths in apple cider vinegar because we've proven so much that it works for everything.
Everything.
What would be the reasoning? Because the reason for the essential oils is because you're helping with like estrogens and progesterone and stuff like that, and that makes sense because there's a physiological reaction to it.
I think it's complete bull.
She's being facetious. She's.
Oh, I took you very literal.
You don't read our faces. She was totally taking you on. Just
yeah,
Asperger's is coming out.
Well,
did.
what is
You
the
were like,
reasoning for that?
oh, anger.
Do you really believe that?
Oh.
The world is flat. I got to level
their
outside.
reasoning was it improves blood flow and circulation. Apply diluted apple cider to the skin over varicose veins and gently massage the area. Do this every day before going to bed and getting up the next morning. Follow this remedy for a few months.
Oh.
You'd probably smell reasonable, right? Because doesn't apple cider vinegar kind of smell
It smells like
nice?
vinegar.
Oh, vinegar?
Yeah,
Oh, I don't want
it's
that.
straight like vinegar. Yeah.
Yeah,
getting coleslaw.
Smell like an old
I'm
person.
gonna every episode we do. I'm gonna see if apple cider
will cure
fixes
it. Yeah, like we're gonna find some like horrible disease, and you're gonna be like, oh,
Should have been drinking apple
cider
cider.
vinegar the whole time.
Why do alcoholics get their spider veins on their nose?
Oh yeah.
The alcoholics and those spider veins on the nose, it's a liver problem. So people with cirrhosis of their liver have 85% of them will have increased estrogen and progesterone just circulating around their bodies. So those small veins will then start dilating, and then you get all these problems with the varicose veins.
Oh.
So it's a liver problem, and so liver cirrhosis is a risk factor for varicose veins. And it is a super high percentage. The study I read on it was like 85% of people with liver cirrhosis have varicose veins, and that's just the increase in
I
estrogen
wonder
and-
if you took your explanation. So if you, let's just use like a male, lifelong alcoholic who has not listened to the family and refuses to get help. I wonder if Scott explained to them because of their abuse of alcohol, they now have estrogen and progesterone, like just, you know, circulating through the, like if that would
Coursing
be,
through your
yeah,
veins.
like you're basically becoming a woman. Like would they
That's
be like,
the
I'm
straw.
done, send me in, I
That's
will
the
get
straw that broke the camel's back.
like, yeah, because you said that and that popped out to me like, oh, so they've
Yeah.
got female. So, but now we talked about the nose. I'm pointing to my body parts like you guys have to follow me to my nose.
I don't know where the nose is, so yeah. that makes
Yeah,
sense.
well, you know, April will tell you because hers was fat when she was pregnant.
Mm.
So, the spider veins that shows up sometimes on the cheeks and stuff. Like I know some younger healthy males that have that. I don't know how long they've had it. And it's not horrible. It's, you know, maybe a little bit of redness and stuff. But why does that happen?
Again, all of the same thing. It's going to come down to a weakened vein wall or a valve problem of some sort for some reason. Could just be, you know, congenital problem. One thing that they found with these weakened walls is, you know, these vein walls are made up of certain stuff. So like fibroblasts make a matrix, and then you've got collagens in there. And they found that people who overproduce collagen type 1 and decrease production of collagen type 3 will have a disruption in the arrangement of their smooth muscle cells or the cells that make up the vein wall, and so then it'll weaken that, and then so if you just have that, then you're more prone to getting them. And they also, you know, people who have an increase in your transforming growth factor beta 1 and fibroblast growth factor beta, you'll also have this weakened wall. So if you just happen to have this abnormality, congenital problem, you can have weakened walls and get these problems. Just because you have high blood pressure or whatever doesn't mean you'll get them, but risk factors or these congenital problems, risk factor.
I like that in today's episode, Scott actually has notes on it because this was kind of, I think, not your idea. You were probably unimpressed by the varicose veins idea, so he had to do research because it's not medical minded enough for him to have like already known it. And so he's actually reading from his notes like a human.
So, well, funny story, I actually didn't get to the specifics till this morning at 6 a.m.
Yeah. That
When I
doesn't
woke up
surprise
early,
me.
and I was like, oh, I should really figure this out before we go and regurgitate it on camera.
But it's just funny because you're on camera. It's not just a podcast, and you've just been you know.
Reading from notes.
Yeah, and it's fun.
Did not commit it to memory.
It's fun. I like
because, you know, I don't care that much. Because I don't have varicose veins yet.
Yeah, but we're all going to get them. That's what you decided.
Most likely, yeah.
So, at the end of the day, varicose veins, we're all going to get them.
Yeah.
They're preventable to a degree.
Mm-hmm.
Also, not preventable to a degree. Difference between spider veins and true...
On the technical level, yes, but they're all a grouping of venous problems.
Yeah. Well, if you liked what you saw or heard today, check us out on YouTube or our podcast.
Or go to our website, medicalconfessions.com. My nose got fat when I got pregnant. Like, everything about me blew up.
Sausage legs.
Everything about me blew up.
Sausage legs. Shiver? I thought you said shit. Try not to shit when I talk. That's always a life goal.
I mean, yeah. At this point in life, it just falls out.
You're not even 40 yet. You're not even 40 yet.
Well, and we can change this to only come from this direction and this direction, so you get nothing from that direction.
Okay. Nothing from the backside. No rear entering of the microphone.
Yeah,
Do not
last
put that in the
night.
reverse. That'll be so embarrassing. It's like the dirtiest thing I've ever said, and I'm like,
I think she was taking out the garbage, and she's like, "Can I use the back door?" And I'm like, I was in the workout room, and then I hear Ken say, "You can use whatever door you want." And I like kind of pop my head in.
nice.
Internet changed you.
Man, back door action. What are you doing?
I think you must have mentioned it, and I listened to you for once. Like, I don't know why, but I feel like I just knew
What?
that.
Someone listened?
About somebody
And
else.
Jen.
I don't listen to
It's
anybody.
a random fact thrown out there.
Yeah.
Good for you.
I know. I'm working
Both
on
of
it.
you.
Good for you guys. That's growth.
And I didn't cut you off.
Impressive.
Good.
Ooh, louder. Sorry. Perfect.
Good clap, April. Well done.
All right.
Let's do that.
Should we clap for her clap?
Well,
Good job, April.
nice.
Welcome to.
Why are you looking at me? That's not my job. You looked at me and I was like, I never open it. God, who doesn't listen to others now?
All right. Welcome to Medical Confessions.
Oh my god.
Yeah, you threw me off. Why are you opening?
Well, the last couple he's posted, it's been where he just starts it, and we haven't been doing our...
Oh, okay. Sorry.
And then it was
I'm
just-
thrown off. We need to communicate.
All right. Why don't I
Scott's
just start
fame's
off?
gone to his head.
There's been like 14 people that have listened to us, okay? I'm a
He's
big
like,
deal.
we have 4,000 subscribers on YouTube.
All right.
And like 20
Go ahead
views.
and open up.
They're always like, play, delete.
Okay, ready? Go ahead and open.